हम इस बारे में चर्चा करना चाहते हैं कि छात्रों के व्यक्तित्व पर वे कौन सी बातें हैं जो प्रभाव डालती हैं। और जैसा कि हर शख्स ये पूछता रहता है कि डॉक्टर हम क्या करें कि हमारे बच्चे अच्छे निकलें। अच्छे से उनका मतलब ये होता है कि उन्हें मानसिक स्वास्थ्य की तकलीफ ना हो। वे इंटेलिजेंट तो रहते ही हैं मगर उनका व्यवहार अच्छा रहे, उन्हें एंग्जाइटी ना हो, डिप्रेशन ना हो, वे अपने क्षेत्र में जो चाहें वो कर सकें, उनकी इच्छा प्रबल हो और इच्छाओं पर उनका नियंत्रण हो। अब इसके लिए ये समझना जरूरी है कि वे कौन कौन सी बातें हैं जो प्रभाव डालती हैं। और पहला उसमें से पहली बात जो हमेशा याद रखनी चाहिए हर माता पिता को कि बचपन में जो कुछ होता है, सकारात्मक या नकारात्मक, whatever happens, positive or negative, always influences growth and development and therefore the mental mechanism. So the first thing is child-mother contact. The mother-child bond is the fundamental thing which is required for development of brain and therefore the development of mind, thus mental health development. Then comes the parental situation, the life of father and mother, the relationship between father and mother, what the children see, what they experience, adverse reactions, whether they are witnessing domestic violence, separation, humiliation, discrimination, poverty, socio-economic deprivation, a number of social factors which are adverse and everybody knows about it, always influences childhood development and mental health development. Many people would give this argument that, well, number of people grow out and develop despite having adverse situation. True, it is true, but it is not true for majority of people. There are chosen few who have the capacity to adapt, to win over adversities, have phenomenal resilience. Why? They have very strong ability to learn from experience. They have very strong ability to adventure, try new things, help their brain to develop, learn from social situation, learn from others, be in the company of wiser people so that their resilience develops. So these are the methods by which you can overcome the influence of adversity. Childhood adversity is definitely related to development of psychiatric disorders when in adulthood. If you ask a group of patients suffering from psychiatric disorders, more than 70 to 80% would commit experiencing adverse childhood events. And if you examine a group of people who have been subjected to some or the other kind of adverse influence, the chances of their developing a psychiatric disorder is about 30 to 40%. These are not mere statistics. You realize this when you meet these people. I have been meeting number of them in my profession, and I can tell you it is very painful to go through and remember the traumatic memory, the flashbacks which they get, sudden arousal which they get, sudden depression which they get, when they remember the event and get frightened, when they don't report for their work with the day they are not well. And why they are not well? Because the memory, the event is encapsulated in the memory system. It does not go, it is not erased, especially because most people do not disclose, they do not talk about it. They feel that time will heal, but time doesn't heal always. Time may not remind you, but time does not cover everything. Those traumatic memories remain. And therefore, if you want your children to be healthy and performing, please make sure that they live a very positive and healthy and integrated, holistic childhood period. That's my first suggestion. If we are dealing with a 16, 17, 18-year-old person, what can they do for development of their mental health. Well, mental health has already developed. Whatever was, it has taken a shape. Personality develops till 18 years, and the experiences, good or bad, are deeply rooted in the personality. So, what can you do now is how to prevent development of abnormalities in mental health and how to deal with those situations which come up. So you need to identify, you need to screen, you must know. So education is the primary thing. We don't expect our children to know about psychiatric disorders or mental health symptoms or how brain and mind works unless we teach them. No university, no college has courses or any mechanism by which a normal student would be exposed to the knowledge and information about mental health. When I say mental health, I mean how mind works, how brain functions, how their personality shapes, what is intelligence, what is perception, what happens when an abnormality develops, what are the factors which contribute. There are biological factors within our body. There are psychological factors which arise from your surrounding, the social factors, and number of factors which combine and lead to a problem. Should they not know about it? Newspaper is not always for education. That is for information. And it is a specific piece of education which the students must have.
मुझे ये पूछना है कि हमारा एडवांटेज है भारतवर्ष में, हमारा जो हिस्टोरिकल बैकग्राउंड है, रिलीजन, प्रार्थना, मिथोलॉजी, तो उस हिसाब से आप क्या कह सकते हैं, आपके क्या विचार है अपॉन रिलीजियसनेस, पर्सनालिटी ट्रेट ऑफ गॉड फियरिंग, गुड वर्च्यूज़, उस पर आप क्या एक दो शब्द कह सकते हैं?
एक्चुअली ये सवाल बहुत ही प्राथमिक है, इट्स अ वेरी फंडामेंटल क्वेश्चन, और इसमें विज्ञान का जो पुट है वो लोग जानते नहीं। रिलीजन और स्पिरिचुअलिटी दो अलग अलग चीज़ें। आप में रिलीजन हो या ना हो, आप फिर भी स्पिरिचुअल आध्यात्मिक तरह के व्यक्ति हो सकते हैं। हम मेडिकल साइंस में आध्यात्म किसको कहते हैं? हम उसका सिर्फ एक लाइन में परिभाषा उसकी यह है कि डू यू बिलीव इन एग्जिस्टेंस ऑफ ए सुप्रीम। इस दुनिया को चलाने वाला, संभालने वाला कोई है या नहीं है, इसमें आपका कितना विश्वास है, यही एक लाइन ये डिस्क्राइब करती है। और मैं आपको बताऊं कि स्पिरिचुअलिज्म इज़ ए परमानेंट फीचर ऑफ मेडिकल असेसमेंट। American Medical Association has prescribed the guidelines that whenever you examine a patient, you must examine spiritual content. WHO did the trial for spiritualism in mental health, and India was one of the centers. So there is no dispute, there is no debate that spiritualistic arm is fifth arm of our health. Why it is fifth? The first is physical health, social health, mental health, psychological health, environmental health, and spiritual health. A lot of research has been done on this, and the findings which you may see around you and you will experience, that the families which have high content of spirituality, what it gives their children is a better understanding, a better wisdom, better cognitive power, better ability to remember, and self-control, self-awareness and self-control. Now, it is not genetically transmitted. It is from the environment which they learn from seeing and watching people, that how it imbibes in their own character. The second, it comes by content of education. So, जैसे कि आपने बात की कि प्रार्थना से क्या फ़र्क पड़ता है, प्रार्थना से बहुत फ़र्क पड़ता है। कैसे आप फिजियोलॉजिकल डिसिप्लिन सीखते हैं, योर लेवल ऑफ कमिटमेंट गोज़ हाई। और मैं आप वो किताब पढ़ें गायत्री मंत्र के बारे में। योग और गायत्री मंत्र के बारे में बायोलॉजिकल रिसर्च दुनिया में बहुत हुई है। लगभग 400-500 पब्लिकेशन है। मेरी खुद की एक किताब है जिसमें सारे फाइंडिंग्स उसमें एनालाइज करके लोगों के सामने रखे गए हैं। ये एक वैज्ञानिक पद्धति है। लोगों को ये समझना चाहिए कि स्पिरिचुअलिज्म इज डायरेक्टली कनेक्टेड टू ब्रेन एंड देयरफॉर डायरेक्टली कनेक्टेड टू माइंड. It is not a capsule of treatment, but it has to be within your life, in the routine of your life, in content of your life, in the principle of your living, like you define purpose of living. For example, those students who have very high purpose of living, they may have suicidal ideation, but they would not commit. The people who, as I was telling many times, I say that you see the patients who are terminally ill, and when you give them in spiritual intervention, spiritual treatment, they can accept the end of life very happily, and their pain reduces. So spirituality has in fact, it is the most important content for happiness. Because ultimately, what is the purpose of life? You may become a doctor, engineer, CEO, businessman, and your life is complex. And if you are not happy at the end of the day, you suffer. You suffer and you become sick person. And I'm sure nobody wants to become sick. And therefore, spiritual content should be a permanent part of every child's life. How and when and which modality for spiritualism you start, that's a very different issue. It's a matter of your choice. They all lead to same road. They all lead similar kind of changes in your brain, and therefore they all are equal. So my opinion is this, that it's an important part of every child's life.
Thank you, Dr. Srivastava.